Hi everybody, this is Dr. Ravindran Kumeran. I am a surgical gastroenterologist practicing in Apollo First Med Hospitals, Pundumalai High Road, Kilpauk. What are the treatment options for hernia, right? So hernia is a disease which has surgery as the only treatment option, right? That is the only weapon we have got against hernia, right? So it has to be some kind of surgery, either an open operation or a laparoscopic surgery, whereby you do the operation through small scars, what we refer to as keyhole surgery. Irrespective of what operation you're performing, often maximum number of hernias, or rather put it this way, the majority of the hernias will require a mesh placed during surgery to reinforce the muscle. Now, because there is a weakness in the muscle, which is the cause of the hernia coming in the first place, often you have to reinforce that patch so that that area doesn't give way again in the long run, right? So mesh placement becomes a necessity, except when you're dealing with children. Children are an exception. Children who present with hernias do not require mesh, but any adult invariably requires a mesh, right? So that is the present standard of care. Surgery would be emergency if the patient presents as an emergency. If the patient comes in with pain, with vomiting, with a blocked intestine, then it is an emergency operation. If the patient comes in for a planned operation, then it is a lot more easier controlled setting operation, right? So irrespective of what surgery you do, as I said, mesh has to be kept in. But there are some situations, if the bowel needs to be removed, let's say the bowel is stuck and part of it is dead and has to be cut and removed, then you may not be able to keep a mesh in that sitting. That would entail another sitting at a later stage. But for an elective operation, mesh placement becomes an absolute necessity. It doesn't matter what size of mesh you're using, you can place it even laparoscopically. The present standard of care is becoming laparoscopy slowly. There is a big sea change in the way we are looking at hernias. People used to believe that open surgeries are better for hernias. Those days are gone. We are often doing these operations laparoscopically. Even a very complicated hernia can sometimes be dealt with laparoscopically, and any sized mesh can be easily deployed without the huge scar associated with open surgery. If you're doing laparoscopic surgery, especially the planned ones, the common hernias are the inguinal hernias and umbilical hernias. These hernias are usually very straightforward. Patients can often have this hernia as a daycare procedure. The patient comes in the morning, has the surgery done, can go home the same evening. A lot of patients will probably require to stay overnight for whatever reason, such as insurance and so on and so forth. So most patients will be home within 24 hours. And within a week to 10 days, most patients will bounce back to normal. There are some laparoscopic surgeries which can be painful. Often the pain is because of the way you fix the mesh. The mesh has to be fixed in place, and you may require additional instruments to facilitate that placement, and those can be slightly painful at times. So you can sometimes hear patients talking about pain after laparoscopic surgery. All of that will settle down over a period of time. Usually in a matter of a few weeks, patients will be back to normal. These operations are best done when the patient is asymptomatic. So I would prefer a patient coming in for a planned operation any day as compared to an emergency operation, because you can guarantee that the operation will be done laparoscopically. You can guarantee that the risk of infection to the mesh is the least, and you can also guarantee and give a specific time frame as to how quickly the patient can recover from the whole procedure. So my honest advice to everybody is that if you have a hernia and if you're fit enough to go through a general anesthetic procedure, please go ahead and do the operation at the place of your choice with a surgeon who you're comfortable with in a safe setting. Thank you.